Absorbable implants are temporary biomaterials that integrate into tissues in order to restore volume, stimulate collagen, and improve skin texture. They are indicated in non-invasive aesthetic procedures with natural and progressive results and without the risks of permanent materials. Among the most commonly used are hyaluronic acid, calcium hydroxyapatite, poly-lactic acid, and polycaprolactone. All are biodegradable and biocompatible, and their selection depends on the patient's needs and the anatomical area. Hyaluronic acid, due to its immediate and hydrating effect, is used in mobile areas such as lips and nasolabial folds. Calcium hydroxyapatite, which is firmer, is ideal for the middle and lower thirds of the face. Polylactic acid acts as a biostimulator, gradually improving the skin, and polycaprolactone with longer duration is used in cheeks, jawline, or nose. The technique varies depending on the product, but the use of blunt cannulas, deep planes, and small boluses is recommended to avoid complications. Although these materials have a high safety profile, adverse effects such as edema, bruising, nodules, or inflammatory reactions may occur. In cases such as lipofilling, fat tissue viability depends on the manipulation technique and plane of infiltration. Tissue response follows clear phases: initial inflammation, collagen stimulation, and product resorption. For example, polylactic acid induces collagen between 3 and 6 months, while hydroxyapatite generates less inflammation and more stable integration. To ensure safety, a prior clinical evaluation, appropriate material selection, and active patient follow-up after application are essential.